Hello?
Hello.
Yeah, please, good morning. You are welcome to Abby Morning Show.
Thank you very much.
Yeah, and thank you for joining us this morning. I hope you are doing well.
Yes, please. I agree. And yourself?
I'm good too. Thank you for joining us once again. So let's get right into today's topic. Today we are talking about testicular cancer. I know that most of us have heard about it, but most of us too have not heard about it. So for someone who has heard about it but doesn't really know what it is, what really is testicular cancer?
Now, when we say testicular cancer, we know all types of cancers, and then testicular cancer is one of them. It's a type of cancer that develops in the testes, which we all know that the testis is part of the male reproductive organ responsible for producing sperm and then the hormone called testosterone. So that is all about testicular cancer.
Okay. Who is at risk of developing it? Should it be is it only older people or younger people too?
Okay, so everyone can get testicular cancer, but mostly young men between the ages of 15 to 35 years, and then also men with a history of undescended testes. When we say undescended testes, some people are being birthed with only one testis, or both of the testes couldn't descend into the scrotum. So people like this are at high risk of getting testicular cancer. And then also, if the person is coming from has a history of testicular cancer, they can also have it.
Okay, so you talked about family history, and if say my family we don't have any history like that, should I say that I'm not at risk and I can do whatever I want?
No, it's not particularly someone having the history of testicular cancer in the family, but as I said earlier, anyone can get testicular cancer. It's not necessarily you having a family history on that before you can get a testicular cancer.
Okay, so what are the signs and symptoms you should look out for?
Okay, so some early signs that will help one detect that I'm having testicular cancer or it's in the process is you have a painless swelling in either one of the testes or both of your testes. So you have a normal testis, but all of a sudden it is becoming bigger. It should alert you that there is something wrong with your testis and you have to pay attention to it. And you also know that the scrotum is not so heavy, but all of a sudden you feel some heaviness in the scrotum. You should be alert that all is not well, and then you can have a mild ache in the lower abdomen, that is beneath your stomach. You'll be feeling a little itch or pain, or at your groin, you feel some itch there. Then it should tell you that you have to pay attention to your testes.
Okay, so like you said there will be the testicles will swell, and then does it come with like excruciating pain or it's a mild pain?
When it is swollen, it's painless.
Okay.
You feel the place is swollen, but you are not feeling any pain. Which we know that if a part of your body gets swollen, at least you should feel some pain. But in this situation, if it's swollen with no pain, I'm able to alert you that, no, why is it that this part of my body is swollen, but I'm not feeling any pain? Then you should know that there is something wrong over there.
Okay, okay. So, madam, what are some of the causes? Miss Shawayana, what can she craft from my? It's a better no be then a cause a testicular cancer.
Testicular cancer, as I said earlier, it's mostly caused by undescended testes or family history. Yeah, it's not about, let me pinpoint this, not having different sexual partners. No. Not the cause of testicular cancer. Normally, if you have undescended testes or a family history of testicular cancer, and sometimes hormones can also cause testicular cancer.
Okay, so when it is detected, can it be treated? And then if it can be treated, the treatment available, is it like going to cure it completely, or is it like the normal cancer that we've heard of, chemo and all that? How is the treatment like?
Okay, testicular cancer is treatable. It is very, very treatable. Even at a higher rate, when we detect it early, even at a rate of over 95%, it can still be treated. It is curable.
Okay. So have there been cases where they would have to maybe cut off their testicles or something like that?
Before any treatment can go on, when you feel your testes are swollen or there's any difference in your testes, you can first examine it by yourself at home by just rolling your balls in your hand. In fact, it's something that should be done every day after taking your bath to check whether your balls are okay. And then also you can detect that with ultrasound scan. That is the scrotum scan.
Okay. So after you have checked, can you also so is it like anytime you want to check, can you just walk into any hospital and ask them to check your testicles for you?
Of course. You can just walk into any nearby facility and then ask of the ultrasound department or see a physician and tell him or her, oh please, I want to examine my balls, my testes. I want to have a scrotum scan. Or even if you forget the word, you just tell the person, oh, you just want to examine your balls with a scan. Yeah.
Okay. So before I let you go, what final words do you have to say to our viewers?
Okay, my final words are testicular cancer is highly treatable, especially when caught early. And then also regular self-examination. You don't have to wait till you feel uneasy in your testes before you rush to the clinic or the hospital for examination. You can be doing it yourself, and then you always have to remember that early medical attention can save your life. Yes. So that is my final words for our viewers.
All right, thank you so much, madam. Thank you for coming on the show and then sharing your knowledge with us. We really appreciate it. We will definitely talk to you soon. Have a good day.
Thank you very much. Have a great day too.
Thank you. Bye. Okay, I have four names here for your name, Madam Patience, and come agree and a church in common and come on a church in fat testicular cancer. In him say a cababre, a cabrofu bebre. Now the tough and say, you can't testicular cancer, you shall member your boss na a cancer, a affected boss no, but the